Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We're going to talk about Trump and his assault on the healthcare world and a number of other good stories. But before we do, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. It is the text for today's video. It has all of the links I talk about, all the links to medical research reports, studies. It has a host of resources you might find useful. You can subscribe for free. We don't take money for it. And it gets delivered to your inbox almost every day. So let's talk. First, I want to talk about an adage from the 30s, don't agonize, organize, because that's what's going on in Massachusetts. Medical providers at Cambridge Heart Alliance, 230 clinicians in Massachusetts, won their union election and have received certification through the State Department of Labor Relations. Half the group's members are doctors, including primary care physicians, psychiatrists, hospitalists. Members also include PAs, physician assistants, and psychologists. You can find a link to the AFSCME website that talks about it and to the MedPage Today's story about it in the newsletter. I want to talk about congestive heart failure warnings coming soon to a smartwatch near you. A team of physicists at Tampere University in Finland developed groundbreaking techniques for detecting congestive heart failure with greater ease and precision than anyone ever thought possible. The multidisciplinary study involved cardiologists and physicists, and it builds on the team's earlier breakthrough in predicting the risk of sudden cardiac death. According to their new study, congestive heart failure can reliably be detected analyzing the intervals between successive heartbeats, interbeat or RR intervals, which can be measured not only with professional equipment that your doctor would have, but with a smartwatch or regular heart rate monitors. The research was published in Heart Rhythm 02 on the 31st of January. There's a link to it in the newsletter. The new method is based on advanced time series analysis. Of course, that's what the physicists would know how to do. And it allows the investigation of dependencies between interbeat intervals at different time scales, along with other complex characteristics typical of heart disease. The researchers analyzed multiple international databases that had long-term electrocardiograph recordings from healthy control subjects and patients with heart disease. They focused on distinguishing the patients with congestive heart failure from those from the healthy control and from those that had atrial fibrillation. The new method was capable of detecting congestive heart failure with an accuracy of 90%. Currently, detecting congestive heart failure from interbeat intervals alone is unobtainium. It's just not possible. It's very hard to do. In contrast, AFib, atrial fibrillation, is easier to detect, and smartwatches do it already. So there's a link to the Tampere University report on this as well. Let's talk about some new materials from Penn State. This is also extra cool. A biomaterial that can mimic certain behaviors within biological tissues could advance regenerative medicine, disease modeling, soft robotics, and more, according to researchers at Penn State. Materials created up to this point to mimic tissue and extracellular matrices, ECMs, that's the body's biological scaffolding of proteins and molecules that surround and support tissues and cells, all have limitations that hamper practical application. To overcome some of the limitations, the researchers developed a bio-based living material that encompasses self-healing properties and mimics the biological response of ECMs to mechanical stress. Their reports were published in Material Horizons, and there's a link to that in the newsletter. They developed a cell-free or acellular material that dynamically mimics the behavior of ECMs, which are the key building blocks of mammalian tissue, crucial for tissue structure and cell function. The new material has a cool name, LiveGel. It replicates the self-healing properties, as I mentioned. They are actually able to design and build these gels with different functionality, which allow for way more diverse use in modeling and prosthetics. The next steps They're going to try optimizing their live gels for specific tissue types, exploring using them in vivo, in live applications for regenerative medicine, integrating live gels with 3D bioprinting platforms, and investigating potential dynamic wearable or implantable devices. This could be like so cool, but it's coming. It's great. Let's talk about Trump cutting medical research funding, because it's not good. The Trump administration is cutting billions of dollars in medical research funding for universities, hospitals, and other scientific institutions by reducing the amount that the institutions get to support the research. The National Institutes of Health said it was reducing the amount of indirect medical research funding going to institutions by about $4 billion a year. There's going to be a 15% limit of 15% of grants awarded to institutions will be allowed for associated costs like buildings, equipment, support staff. This is a major reduction on what was previously allowed under the NIH grant system. The administration has a spin on why it's a good idea. I don't want to go over it. I think it's just garbage. They say, well, we're saving costs and we have to focus more of our money on the research. The problem is, without the buildings and the labs and the support staff, you don't get any research, IMHO. But not just me, it's also Matt Owens, who's president of the Council on Government Relations, who represents universities and medical academic centers. He says, and I'll quote, "This is a surefire way to cripple life-saving research and innovation. America's competitors relish this self-inflicted wound. We urge NIH leaders to rescind this dangerous policy before its harms are felt by Americans. Reimbursement of facilities and administrative expenditures are part and parcel of the total cost of conducting world-class research." Let's have another story about Trump, because my stomach doesn't hurt enough. Mr. Trump, put back the data. Medical groups are expressing deep concern about the sudden removal or alteration of government data sets and web pages from agencies like the Center for Disease Control and Prevention and the Food and Drug Administration at the behest of President Donald Trump's administration. The American Cancer Society, a nonprofit organization dedicated to eliminating the disease, called on the administration to restore access to comprehensive data, refrain from changes that would lead to incomplete future data collection, and commit to ensure evidence-based science can proceed without additional bureaucracy or red tape. This was in a statement that they published on their website last week. It's in the newsletter. You can go read it. Any restriction to gather and release these data could thwart our ability to address and reduce the cancer burden across all communities, Interim CEO Dr. Wayne A.I. Frederick said in a statement. The organization highlighted the removal of the Social Vulnerability Index, which uses U.S. Census data to identify county-level risk and vulnerability factors facing communities, taking into account things like poverty, race, disability, housing, lots of things, all according to the CDC. Data from public sources like the Social Vulnerability Index are key to deploying the right resources to those who could benefit the most. Therefore, any barrier to accessing these data can also have repercussions on planning and deployment of support services for cancer patients and survivors. ABC did a story on it. There's a link there. Let's take an action. Tell your member of Congress and senators and the president, put back the health-related data scrubbed from the websites. Now, I understand today, a day later, a federal judge may have ordered that, but you know what? The Trump administration drags their feet and they're violating the law right and left. So let's send this to Congress. They're putting patients' lives at risk for political power. In the YouTube description box, you'll find a link so you can contact your elected officials. Phone is good, email is good, or you can use the ResistBot script below as a template if you want to talk to them. Or you can just send a text message, sign, S-I-G-N, space, PNATNR, sign, space, PNATNR, to 50409 on your cell phone. Here's what you'll be sending. I'm your constituent, and I am deeply concerned by the removal of medical databases and information from federal government websites. Medical providers and hospitals need to be prepared as diseases spread among the population, yet much of that data is no longer available. Data from sources like the Social Vulnerability Index are key to deploying the right resources to those who could benefit the most, especially when cancer is involved. Any barriers to accessing these data can also have repercussions on planning and deployment of support services for cancer patients and survivors. In case you weren't aware of it, that's about 100 million Americans. I strongly urge you to do everything in your power to restore those data sets and reports and allow medical data collection to resume, to give medical providers the tools they need to deliver effective treatment for their patients. That's what I've got for you. Down below, you can like, share, subscribe, send me comments here or at healthcareadvocacy1, all one word, at gmail.com. Have a good evening.